welcome back. Today is Bell Let's Talk Day, a national initiative aimed at ending the stigma around mental illness.
And for more on this, we're joined live now in studio by Dr. KatyKamkar, a clinical psychologist with the Center for Addiction and Mental Health. Thank you so much for joining us.
Thank you.
A really important initiative and conversation that's been taking place all day. Let's talk about the stigma, first of all, around mental illness. What are some of the perceptions that people have?
I think that obviously the initiative with Bell Let's Talk Day, it's so important. We have noticed over the years an improvement in terms of there is a reduced stigma attached to mental illness. Obviously, there is room for further improvement. What's very important right now, just as physical health problems, we need to raise awareness of mental health problems, open up the dialogue, the communication, and most importantly, normalize the talk around mental health problems to further work on reducing the stigma, because the stigma is a significant barrier not only to receiving diagnoses, but is also to receiving treatment, and is also a significant barrier to acceptance in the community. And so people just suffer in silence.
And a lot of that also has to do with acceptance within your workplace as well. And I think that we're starting to hear more workplaces have this conversation every day, not just on Bell Let's Talk Day.
And you're absolutely right. We know that the costs associated with mental health problems are within $51 billion annually, and that's very much 35% of this is associated with mental health disabilities, and that's because, again, mental health problems are associated with increased absenteeism, reduced productivity, increased presenteeism, sick days, short-term and long-term disability. And so developing and maintaining workplace mental health programs very much lead to mental health promotion, prevention, and our positive return on investment.
And so for somebody who may not know what the symptoms are, may not know if they're actually suffering, can you give us some tips on what people can look for?
Well, of course, depending on, variety of mental health issues, but generally if we feel that there are changes within the way we are thinking, or changes in our behaviors, or the way we are feeling, or any physiological changes to the point that the symptoms cause increased distress or interfere with our functioning or daily activities and responsibilities, and it's important to seek help. So for example, if we notice that our mood is sad most of the day, nearly every day, or we suddenly feel very anxious and nervous most of the day, nearly every day, appetite changes, sleep changes, concentration is down, energy is down, suicidal thoughts. So any of those symptoms, again, occurring, more days than not, to the point that they increase distress or interfere with our functioning, it's very important to seek help.
So we've been talking all day about mental health issues.
Yes.
What are some of the names attached to those issues? We talk about the symptoms, but what are some of the things that people are experiencing? We obviously know about bipolar.
Absolutely.
What are some of the other
Absolutely.
disorders?
So we can be, as you said, bipolar. We also have clinical depression, anxiety disorders. So we can have generalized anxiety disorders. So when we suffer from excessive worries, difficulty controlling the worries, panic disorders, when we have sudden onset of panic attacks and we're afraid of the symptoms, or we're afraid of going out as a result of the panic attacks. We also have social anxiety, so feeling anxious in social situations. We have specific phobias, or phobia to specific objects or situations. There's as well, of course, post-traumatic stress disorder, with now very much we hear a lot. So when we are exposed to trauma and we have distressing memories or intrusive thoughts or nightmares, flashbacks associated with the trauma. And there's as well eating disorders, so bulimia and anorexia. So there are a variety of mental health disorders, including as well schizophrenia and substance use disorders.
All right. So Dr. KatyKamkar, we thank you so much for joining us and giving us some insight onto this. And of course, we'll keep the conversation going, not just today, but every day of the year.
Exactly.
Thanks again. Thank you.